Hello everyone, my name is Albizurez-Lopez. I am doing my presentation on autonomy versus beneficence. I will be discussing a medical article that discusses ethical dilemmas. The name of this article is What the Moral Distress of Doctors Tells Us About Eroding Trust in Healthcare. So, a quick summary about this article is that it goes well into detail about ethical dilemmas that doctors face very often. Some of the ethically challenging cases they're faced with are in pediatrics and adult medicine, and the main idea explored here is that they go through moral distress when they have to act against their professional judgment due to the patient's family wishes. Another great point in this article is that there is a decline in trust between the patients and doctors. So the author emphasizes that doctors face even more distress when their professional judgment gets questioned or refused by the lack of the patient's trust. So we need better training in medical institutions. All of this is discussed, and how there's also more room for guidance and improvement in handling such emotional taxing situations. An example that I found very interesting in his article was how there is an incident in which a 6-month-old baby has an accident, and he suffers a head injury followed by a cardiac arrest. So the physician's recommendations are to stop extensive treatment because the medical team just believes that the baby will either not survive, and if they do, there's just no signs that the baby will have a high quality life. However, the mother refuses to end the treatment because of her religious beliefs. She has hopes for a miracle. So this situation raises difficult questions about the ethical obligation of the doctors, of the obligation for the doctors to continue life-sustaining treatment when they feel that it only prolongs the suffering of the patient. So this becomes very difficult to do while also respecting the patient's wishes and acting in the best interest of the patient. Another point here that I want to talk about is that the article also demonstrates the importance of trust between the doctor and the patient's family. The family needs to be able to trust the doctor's ability to choose the best course of action for the patient, and the main idea in this section discussed is beneficence, which it really contributed to my title because I do believe that this article really emphasizes the autonomy, which is the saying of the patient, versus beneficence, which is the act of maximizing the benefits and minimizing harm to the patients, where the physician's role is to act in the best interest of the patient. There's many ethical dilemmas discussed in the article, but I will be talking about 3. Number 1 is continuing treatment versus prolongation of suffering. Example is the 6-month baby, where the ethical dilemma here was continuing life-sustaining treatment when the treatment is unlikely to provide a good quality of life. I feel like here the doctors are not respecting a core value, which is non-maleficence, which means do no harm. The doctors in that case felt they were doing more harm than good, which is where the moral distress was coming from. Example number 2 is balancing family wishes and patient welfare. The families make their decisions based on beliefs, their morals, religious beliefs, maybe other family or friend influence, versus the doctor who makes their medical decisions based on their years of experience and medical training. That's where it gets a little complicated, because there are instances where miracles do happen, or something happens where medical there's no medical proof of how it happened. Sometimes patients just get cured from cancer and there's no explanation. I've read articles about this before. So a lot of people do hold on to that. They do hold on to hope, but that's not the case all the time. That's like a 1 in a million chance. Moving on to number 3. So trust in healthcare providers. This was another topic that was discussed very briefly, but I thought was very important, which the mistrust between the providers and the patients, it just complicates things. It complicates the decision making, it creates conflict, it creates stress, and it can even lead to the patients just withdrawing from care or not even deciding to do the treatment because they feel that their best interest is not their best interest is not in the number one priority for the doctor. I thought those were the 3 main ethical dilemmas that I thought were very important in this article. Now moving on, I would like to open the floor for discussion. I have 3 questions that I would like to share with my classmates and kind of really think about and see how we can make things a little bit better, I would say. One question is, at what point does medical intervention cross the line from life-saving to prolonging suffering? That question really came from the 6-month-old baby. It's very sad, but it really does make you think, where's that fine line where should we keep going, or should we just... It's very hard to say when you're not in that situation. But I thought this was a good question to include in my presentation. Second question, how should medical institutions support their staff who experience moral distress in situations where they feel that their actions are causing harm, yet they're still obligated to follow up patients' families' wishes? And my last question here is, with the decline in trust between physicians and their patients, what are some things we can do as patients to be less skeptical about treatment plans? That kind of just ties into my ethical dilemma number 3. It just gets a little tricky, but I know that there's a lot of room for improvement there. And these are my references, and I would love to hear from everybody. Thank you so much.